Okay, in this video I'm going to demonstrate how to do an IV piggyback or secondary medications. So to start, I want to prepare and administer medications based off of the 6 medication administration rates. So that's right patient, right drug, right dose, right time, right route, and right documentation. So to start, I'm going to do hand hygiene. I'm going to make sure my patient's safe. I'm going to make sure I'm safe. I'm going to give my patient privacy, and then I'm going to make sure I have good body mechanics overall throughout the procedure. I'm also going to use the 3-check method. So what I'm going to do is I'm going to check the MAR first in the provider order, and then when I'm taking out my medications, I will be then checking my medications again against the MAR, and then I will check them at the bedside. So we're going to check the MAR, and it looks like we're going to administer chloroform 560 milligrams IV piggyback every 8 hours. We have a reconstituted bottle of chloroform that is 500 milligrams per milliliter. We're going to place it in 50 milliliters of 0.9% saline, and we're going to infuse over 45 minutes. And we're going to give 4 doses. So to start out, we're going to determine if the medication dose is appropriate for that patient, so for their age and for their weight. If it's not, then we'll give the provider a call, or if there's an error, we'll talk to the provider about it. So I'm going to get my medication here. I'm going to open my bag. And I'm going to make sure it's the right medication. So I'll check it, again, I got 0.9 of saline. And then I'm going to get my reconstituted medication, my needles, and then I need some alcohol prep pads here. Let me see where they are. Okay. So after this was reconstituted, we would want to put the, the specific label on it. Or this reconstituted, once this is reconstituted, we'll make sure we have the right label on it as well, and that we fill everything out for that. So now I'm going to, got my medication, so I'm going to cleanse the vial. And I did the calculation, and we're going to be putting 1 milliliter of fluid into the piggyback. Of the medication, excuse me. So I got my needle. I want to draw up 1 milliliter of air. Put that in. I'm going to pull it up here. And then I want to draw up 1 milliliter of fluid. Sure there's no air bubbles. And then I'm going to do the scoop method and recap my needle. And then I want to take this needle off, and I want to put on a sterile needle because we want it to be sterile when it goes into the saline. So now I'm going to take an alcohol swab, and I'm going to cleanse the port on the saline. Allow that to dry, and then I'm going to uncap my needle, and then I'm going to place in the bag and inject it. So once that's injected, we'll pull the needle out. We'll put this in the sharps container, and then I'm going to mix it. I'm just going to move it back and forth like this. Just from end to end. Okay, and then once that's mixed up, we're gonna get our tubing. 10 drops per minute, we want to look at that before we open it up. I'll open it up here. Okay. You want to clamp the tubing. And then with this, you're gonna take the main IV bag here, and you're going to clamp it or put it on there, because this needs to hang lower than the IV piggyback. So once this is clamped, we're going to take off the cap here, and then we're going to take off the cap to our little spike. Don't touch the spike, we want it sterile. And then we're going to place it into the IV bag, piggyback. So once you got that, we're gonna fill it halfway in the drip chamber, okay? And then we will want to unclamp and prime the fluid down the tube. Once that's primed, we'll check for air bubbles. Look good. And then we're gonna hang it above the sodium chloride, or above the saline, or the actual IV fluids, excuse me. And then when we clamp it, we want to clean this port, and we're gonna do the port above the roller clamp. So we're gonna clean the port with an alcohol swab, and then we're going to connect. Once that's connected, so I have it hung, I'll just try to hang it here. So I have it clamped back after I primed it. So I did my infusion rate, so we want 11 drops per minute. So that's what I'm gonna set the pump to. It'll be 11 drops per minute. And then after that, I'll just assess. So when it's all finished, what I'm gonna do is I'm going to tighten the clamp, and I'm going to remove it from the primary IV bag, and I'm gonna put the primary IV bag back where it was, and then I'm gonna put it back to the flow rate that it started as. So before we put the IV piggyback, we'll put the flow rate back to the original flow rate, and we'll put it back to its original spot. And then I'll document the times that were given when it was finished. I'll document how the patient tolerated it. I can also check, the IV catheter, check the patency, just to make sure there's no redness or anything around it. And that is that.